that, you know, what it is like for all of us, because all of us need help from time to time setting,
Yes.
you know,
Yes.
setting templates for our lives.
Yes. So understanding the spectrum of help that you can get from a mental health professional is the most important thing. So it's not just like, you know, people who are hearing voices or, muttering to themselves, that, as you said, the extreme form, or the people who are completely dependent on substances. We often see them in, like, shady areas around train stations and things like that. It's not just them that can benefit from help. It can, when you go to a psychiatrist, perhaps, like, maybe if you're thinking about, getting some medical help for it, it could be something as minor as mild depression, moderate, severe depression. It could be for the whole range of anxiety disorders. So that could be something as simple as generalized anxiety disorder, which a lot, like almost 40% of the population has without even realizing that they have it. It could just be like worrying about every single thing. You know, there's no focus. I said, like, you ask them, has anything happened? They're like, no, there's nothing going on really in my life. I worry about anything. My child is late from coming from school, and I'm worried. Did something happen to them? Just like the groceries haven't arrived on time. Will they come? So every single thing, and it leads to physical manifestations. It leads to acidity, headaches, body ache. So generalized anxiety disorder is such a thing that so many people suffer from, and no one thinks that. They just be like, oh, she's just a worrier. He's just a worrier. They just tend to worry about everything. You can even get help for something as simple as that. And it makes such a huge difference in your quality of life if you're not spending your whole time worrying about things that may never happen. So
but 40%. I mean, that seems like
that's very high. It's one of the most common mental health disorders is just your anxiety, but then you can have your phobias, you can have your social anxieties, you can have your OCDs. Then there could be, as I was saying, substance use disorders. Doesn't have to be a major one also. Then, of course, you could have your personality disorders, and your could also be in the advanced stages, cognitive impairments. Because the thing about cognitive impairments is once it advances to dementia, it gets very difficult to manage it. But if you manage it at the basic, at the starting off level, we don't have treatment to reverse it right now. We just have treatment to decelerate it. So the earlier you start treatment, the better it is. So you can go to a mental health professional for anything. And it doesn't have to be something that has completely taken over your life. And that's something I find very heartening in the younger age group now, is I think that even without their parental support, I have a lot of them who are just coming to me without telling their parents that I just want to tweak my life. Like I was like, you have no problem. It's like, no, I just want to get better, And they'll come in, they'll do their homework, they'll schedule appointments for every week. So it's really amazing. Yes.
That's really heartening. It's great that the next generation have a positive, idea of the help that they can get from a mental health professional. I guess that for many people, the fear, there is also fear of what happens when I see someone. Okay, I pluck up the energy, the strength. I know I get a referral from someone. Here's the name of a doctor that I can actually go and see. What happens when a person actually shows up? At the psychiatrist. Talk us through that whole process.
So we have two mental health professionals, largely speaking of it. Let me first speak about psychiatrists. So psychiatrists are people who have a degree in medicine. So they're MBBS doctors who specialized in psychiatry. So largely, at least in India, the underpinning is biological. By that, what I mean is that they understand it more as a neurotransmitter problem. And maybe the social and the psychological aspects are a little lower in what they manage. Okay. So a lot of times, if you're having not a very major problem, people approach a psychologist first. And a psychologist will see whether this is something that can be managed just on the basis of a psychotherapy or a talk therapy. And then they see whether they can, if they can't manage it just by that, or if someone's worsening, then they might refer them to a psychiatrist who would then take care of the medication. When you go to a psychiatrist, at least in Bombay, you could have a wide variety. You could have young psychiatrists who have the luxury, I would say, to operate based on an appointment system. So you have an appointment. The more senior you get, the hard fact is we just don't have enough mental health professionals all over India. Of course, Bombay has a higher percentage, like in terms of concentration of psychiatrists. I think like you walk down Juhu and every like 200 meters would be another psychiatrist office, right? But as compared to the population, there just aren't enough psychiatrists. So they may not be able to, once their fame like precedes them, like they will have to just kind of call all patients at like a similar time. There might be some waiting involved. But with a psychiatrist, usually an appointment would be about 15 to 20 minutes. This is the people who are just doing the medication part of it. So 15 to 20 minutes, maximum half an hour. And realistically speaking, that's all. We don't need more time for a diagnosis because you're not spending that long seeing why the patient got there. We're just seeing what the symptoms are, making a diagnosis. So a lot of times, I mean, I personally have a 50-minute session. I probably know the diagnosis in the first 15 minutes, but it's just for the bonding that you keep the session for like a 50-minute thing. If I was just giving medication, right? But a lot of people say that, oh, the psychiatrist spent only 10 minutes with me. How do they know what's happening to me in 10 minutes? But that's because they're looking at it from a very different perspective. They're not looking at it from the whole psychological and social perspective. This is just, okay, is there a mental health disorder? Is there any medication that will help them at this point in time? And prescribing the medicine. So I wouldn't want to knock on that model because there are a lot of disorders in which psychotherapy cannot be the first line of treatment because the patient is not in that frame of mind to be receptive of psychotherapy. So you could have bipolar disorder, you could have schizophrenia, you could have severe depressions, where the patient is, in a very pessimistic state of mind, contemplating self-harm. So at that point of time, you can't frustrate them. You can't say, why don't you think about, they just don't have the tolerance for that level of frustration. So the psychiatry model does work for a lot of the major mental health problems.
We can get the help, notice the signs, get that fracture, that the plaster on, get the plaster on. I love, how Dr. Ivana.
Yes. And I think that's an analogy that really works with people because I think no one who has a fracture is just going to sit on it and say, I'm just going to let it take care of itself, so it's,
That's true, but sometimes I'll tell you, we sometimes think we have an image of what a fracture looks like. So if we think we fractured our hand, we almost think, we should see a bone jutting out. I've got a fractured hand. I remember when I was a child and I fractured my hand, it hurt, but I didn't think, I needed, it was fractured because I could still function with pain. And so I carried on for months with this hairline fracture until it came to a point where I just couldn't, I was not willing to continue with the pain. And that's when I had an x-ray and realized, oh my goodness, I've been living with this fracture, running around with this fracture that could have been better by now, but I didn't seek the help I needed. Because it didn't look like something that, how I thought it should look. So, it doesn't always look like we need help because of the boxes we put. What a person who needs help. How does a person look that needs to go to a psychiatrist? We have our image of that and we think, no, that's not me. But actually, we can all get the help that we need.
Certainly. Certainly.